Hi, my name is Jennifer Rigdon, and I am a proud board member of the American Cancer Society Missouri Board. And I am delighted to welcome Dr. Miller here today to talk to us about women's health. And it is, in fact, Women's Health Month. So, Dr. Heidi Miller is an internist with Family Care Health Center in St. Louis, as well as the lead for the St. Louis Regional Breast Health Navigation Group. And if that's not enough, she's the medical director for the St. Louis Regional Health Commission. So you wear a lot of hats there, don't you, Dr. Miller?
Yeah, staying busy.
Well, that really leads us into our first question, which is women wear a lot of hats and they take care of other people. And especially with the pandemic, women have really kind of in an outsized way been responsible for taking care of children and education while kids are at home, et cetera. And then still trying to work at the same time. So why is it so important for women to keep their cancer screenings on schedule?
Yeah, we're doing catch up now. We've been in crisis mode, some of us more than others, and it's been really important for us to just survive this pandemic. But at this point, as we are evolving through the pandemic, we need to not only survive this infectious disease, but we also need to thrive in the rest of our body. It is very well established that mammograms help to really curb the morbidity and mortality of breast cancer. And so it's always important to get a screening mammogram, but many of us women need to do catch up. The good news is that the mammography suites are open. Our mammography vans are available, and we are eager to catch up on that screening. It is known to save lives, and it's really important that despite the excruciating level of detail and demands and stress from every day, that we maintain our overall health and that each one of us can go and get a mammogram and bring a friend or bring a loved one. The health facilities that are providing mammograms are doing so with safety measures, mitigating measures. I recommend wearing a mask and cleaning your hands, and everyone who is working there is doing the same as well. But it is now safe to get a mammogram. In fact, it is encouraged.
And I can say that my experience earlier this year having my screening mammogram was very safe. Everyone had on a mask. There were lots of sanitizing processes going on. So it's safe for women to go get their regular screening is what I'm hearing you say.
Yep, absolutely. It is time. There is no reason to delay at all. And, you know, screening for breast cancer consists of mammogram screening, but it also consists of breast health awareness. So if a woman feels any abnormality in their breast, or they notice any changes in their skin, or if they notice a new asymmetry or a puckering of the tissue around the breast, that needs attention, and you need to let your doctor know right away. It's not enough to even just go to a mammogram. You need to let your doctor know that you've noticed a difference in your breast. And some women, it's very understandable, but out of fear, if they notice a slight change to their breasts, are fearful, are afraid to bring it up with a doctor.
Right.
However, so often an abnormality of the breast, if it is breast cancer, can be treated and cured if caught early. And oftentimes it's not breast cancer, but you can have the doctor identify what the problem is so that you can sleep at night. It's much easier to take care of your family and all the demands of the day if you don't have this health issue worrying you and hanging over your head. So at this point, again, whether you're going for your screening mammogram or if you have a breast concern, there is zero reason to delay or to not come in.
And so what I'm also hearing is that you have to be familiar with what your breasts look like now
Yeah.
in order to identify something different. So I know we talk about breast self-exam, but it's also looking at them and making sure that there are no changes. And so I think that's something we don't hear a lot.
Yeah. We just need to have that awareness, and also just the scrutiny to realize, like, something's different, and I'm going to stop and I'm going to make a phone call to my doctor, whether it's my primary care doctor or if you happen to have a breast surgeon that you're already affiliated with, to stop and ask for help and ask a question. Do not hesitate at all, because if you have questions, it is our responsibility to provide answers. And if we don't have the answers immediately, then we need to do diagnostic testing to figure that out.
Right. So this all really matches American Cancer Society's message about return to screening. It's time to go get those screenings done now that we're in a better place in terms of the pandemic.
Yep. And I would also add that, as women, in addition to doing our breast screening, we need to take care of the rest of our body as well. So after age 50, we also need to be screening for colon cancer. And I know you've already addressed this, but the cervical cancer screening is really important as well as getting your blood pressure checked and having the rest of your health checked. So we've suffered from a year of physical distancing, but there is no longer a need to do medical distancing. There's zero reason for that. And I'm worried that patients that stay away from health providers for too long are going to get sicker. So yes, return to screening, return to self-care, return to prioritizing one's health, not just as a way to take care of yourself, but to make sure that we're okay to fulfill all of our other responsibilities. I have so many patients in my primary care practice, and particularly women, who put everyone else's health first. The kids, the spouse, the brother, the mother. And yet if that caretaking is their top priority, it's impossible without taking care of oneself first.
I think that's a great message, and one we really can't say enough. I think the next topic that I want to talk about is also something really near and dear to American Cancer Society, which is health equity. So especially with the effects of COVID, minority populations have really experienced health disparities in the time of the pandemic, but they experience health disparities on the regular basis. Yeah. So how do health disparities affect the prevention of cancer as well as women who have been diagnosed with cancer?
Yeah, so health disparities reflect that we are not adequately providing services and screening for people of the global majority. So I mentioned that as, non-white folks, there are multiple disparities that range from screening and treatment and survival. And the etiology of those disparities are multifactorial and historical and have to do with structures in our society, including our medical institutions, that have historically not taken optimal care of all patients. And there have been economic disparities that have translated into medical disparities. So lack of opportunity, lack of economic thriving, and lack of health insurance have contributed to really negative health consequences and negative associations with healthcare institutions. And so in order to thwart and to undermine any sort of structural bias or racism or unfair treatment or historical examples of unfair treatment, each organization really needs to look at their mission, as the American Cancer Society has, to figure out how they can prioritize equity in providing care. And it's important to acknowledge the intergenerational effect of healthcare disparities. And I'll give you an example. My mother had breast cancer, but she was middle class. She had insurance. She'd never been without insurance. She had only had positive experiences with doctors, and she trusted doctors, and she took all their medical advice, and she went through surgery, radiation, chemotherapy, and she survived. And she's turning 77 this month. And so, yeah, she had all the advantages, and her survival reflected that. And what effect that has on me is to regularly get my mammograms and to know that, God forbid, if I had breast cancer, I'm going to be okay because I can do just what my mom did and interact with the medical community and providers to get that treatment. And so I have a positive intergenerational association with good quality breast cancer care that leads to survival. However, in 25 years in practicing primary care, my most challenging case and most heartbreaking case is a patient of mine who had breast cancer who declined treatment. She is African American. Her mother had breast cancer. Her mother's breast cancer was diagnosed late. Her mother did not receive adequate treatment, nor adequate communication and education and empowerment. And her mother died shortly after starting chemo. So when I approached the patient about having her cancer treated, her closest association was her mother. And she basically said, no, I saw what that did to my mother. My mother had a horrible time with her cancer treatment. She started chemo and died. So why would I want to do that?
Right.
And she was as fearful of the treatment and the inadequate and erroneous treatment as she was of her cancer. And for years, she declined treatment for that reason. And I really, as a provider, struggle to understand her. And I really want to comprehend the etiology of her fear, her apprehension, and that fear and apprehension is well-founded. And so it takes a generation and a tremendous amount of effort and mutual respect to engage all members of our community in engaging in cancer screening and cancer care. And so in order to thwart healthcare disparities and to move beyond that and to promote equity, we need to do it on a multifaceted manner, because we need to change our institutions. We need to make our culture more open and welcoming to all people. We need to provide education in a manner that invites bidirectional communication. This is not a do as I say. This is not the doctor gives orders. That doesn't work. It hasn't worked. That's why we have health disparities. So that the equity issue is of enormous importance. Thank you for asking about that.
Well, I think it's really important, all of these factors about access and insurance and education, and there's just so much work to do so that we can begin to see health equity come about. And I think it's certainly a top priority for the American Cancer Society, and clearly a top priority for you as a physician.
Yeah, there's, you mentioned really important structural and social determinants of health that are key for us to acknowledge and to overcome barriers in order to get a woman to a mammogram. This may not be someone's top priority when there are economic demands and crises with the family and educational demands, and getting your screening mammogram may not be on the top of your to-do list when you're in crisis and just trying to survive. So empowering the women in our community to not be held back by social determinants of health, but to have the economic resources, the transportation resources, childcare, and just the time and the space in your brain to take care of yourself when you have other fires that you're trying to put out at the same time.
Right. Yeah, like we said, women are responsible for a lot and wear a lot of hats. There's a lot going on, but we have to put ourselves first sometimes.
Yeah.
So my final question for you is really about living a healthy life overall. We talk a lot about cancer screenings, but what else can we be doing? So as you and I talked before we got started, cancer screening is the let's make sure you don't have cancer, but the rest of it, let's make sure you don't get cancer. So talk to me a little bit about those preventative.
Yeah, so I love this question because I really want to make sure that if someone has breast cancer, that we detect it as early as possible so a woman has a good prognosis and she is likely to thrive and survive. But managing cancer and preventing cancer is not just about detecting and catching it. There are truly interventions that we can do upstream that have been statistically proven to reduce the risk of cancer. So to prevent cancer, yes, get a mammogram, but there's so much more that you can do. And you're speaking to the heart of a primary care doctor. I entered this field because I truly care about a woman's entire health. I try to do everything through this holistic lens, and there's so much we need to do to keep women healthy besides just preventing cancer. But fortunately, the things that we need to do to prevent cancer are actually the exact same things that we need to do to prevent obesity and heart disease and diabetes. And so sometimes these are opportunities to get a woman's attention. Like, yes, they know that they should probably be physically active, but do they realize that physical activity is not just good for your heart and for your lungs, but it actually prevents breast cancer? So specifically to prevent breast cancer, preventing obesity, keeping the weight in check is incredibly important. Not smoking is key. Most people know that you need to not smoke to prevent lung cancer, but it is also extremely important to prevent breast cancer. So keeping one's weight in check, not smoking, being physically active, and then eating fruits and vegetables and a really healthy diet, avoiding processed foods, and getting lots of healthy nutrients from the produce section of the grocery store. And then also avoiding alcohol. So yes, we all know that you should minimize alcohol to protect your liver, but I'm not sure that most women realize that avoiding too much alcohol can actually reduce your breast cancer risk as well. And then in addition, there are other preventive factors. So breastfeeding, if it's feasible, so healthy for the baby, but also extremely beneficial to the mother and can prevent breast cancer. And then if somebody has a family history of breast cancer or has an increased risk for any reason, they can discuss with their provider very specific things they can maybe do with their medication to prevent breast cancer. So that might inform their decision of whether or not to continue birth control pills after 35. There are medications that women can take to prevent breast cancer, such as tamoxifen or raloxifene. And that's only for high-risk patients, but that is a really good discussion to have between a patient and a provider to figure out if their family risk is high enough that they would actually need to take medicine to prevent breast cancer. And then also when a woman decides whether or not they need hormone replacement therapy at menopause, there is a slight increased risk associated with that in increasing breast cancer. So again, another reason to connect with one's provider, their primary care provider or their OB-GYN, their family medicine doctor, or if they happen to have a breast specialist, to speak with their breast specialist.
So it's all connected. None of this is on its own. It's always amazing to me when we talk about something like smoking, how it increases risk for things like breast cancer, for things like colon cancer, which I never would have imagined. So all of these things are interconnected. So your whole health is connected to all of these screening and, just health focused activities so that you can live a long and healthy life and really try to prevent those cancers.
Yeah, and I would add to that, I would sweep in our behavioral health wellness, because I've been so humbled. If someone is feeling stressed, they're and depressed or anxious, cognitively, they know, like, oh, I shouldn't overeat and I shouldn't smoke and I shouldn't drink too much alcohol. But when you are feeling vulnerable and traumatized, it's extremely difficult to execute those
Yes.
important health decisions. So it's all like, we need to tie breast health into heart health and lung health and the holistic health of the whole body. But it's very difficult to make those healthy choices if we're under stress, if we're traumatized or re-traumatized, or we're in crisis mode through the pandemic, for example. And so taking care of our mental well-being is directly connected to our ability to take care of our physical well-being. And what I'm seeing in the clinic is that we are churning through, we are evolving through, we are passing through this pandemic. And patients are adjusting, and they are coming out of their homes, and they are coming into our clinics and into our mammography suites. But it's also time to really nurture our mental health as well, so that we can continue to thrive in this holistic way, the way that you said.
And if you need mental health services, be sure to reach out to your doctor. Any doctor will do at this point, I think, and they can send you in the right direction. It's so important for us, especially given this pandemic, but all the time, to be aware of our mental health and the strains that all of the things that are going on put on us.
Yeah. Yeah. Well put.
Well, I want to thank you so much for your time. It has been a delight to talk to you, and I think this information is really important and good for our audience.
It's a pleasure, Jennifer. Thank you for the conversation, and I wish you the best.
Thank you so much, Dr. Miller.
Thank you.